Hello, my name is Jeffrey Olin. I'm a professor of medicine in the Cardiovascular Institute at the Icahn School of Medicine at Mount Sinai in New York. And I have the honor this year of presenting the Year in Medicine for Vascular Medicine. And what I did during this presentation is to present the 5 most important vascular medicine topics that have been published this year. And we've had some really good ones. I'll go into just very superficial detail. The first is the Voyager Trial. I think most of you are aware of that. That's a trial of patients who have undergone peripheral intervention, either endovascular or surgical, randomized to low-dose rivaroxaban plus aspirin versus aspirin alone. And what this trial showed is that those who were randomized to low-dose rivaroxaban plus aspirin had a much lower major adverse cardiovascular event rate and major adverse limb event rate. And this appears to be the standard of therapy now in patients who have undergone either surgical or lower extremity revascularization. The second trial is the Caravaggio Trial. This is apixaban for the treatment of thromboembolism associated with cancer, because the question always came up whether or not the DOACs are as good as the low molecular weight heparins for patients with cancer. And with this trial, which was a very large randomized trial, comparing a DOAC to a low molecular weight heparin, and it showed that oral apixaban is non-inferior to subcutaneous dalteparin for cancer-associated thromboembolism. The third trial is from the Swede PAD trial. I'm sure you have all heard about the controversy over paclitaxel increasing mortality in patients who have undergone stenting or balloon angioplasty with drug-coated stents. And this was an interim analysis of this trial to look at the mortality. After 1 year, some patients followed up to 4 years, and basically what they found is there is no mortality signal in patients who receive paclitaxel. That's very, very important. So this study showed that the fluoroquinolone antibiotics markedly increased the risk of all-cause death, aortic surgery, and aortic stenting. And therefore, in patients with aortic aneurysm or dissection, or any aortic disease, you should avoid the use of fluoroquinolone antibiotics. So I think you will be excited when you hear about the studies that have come out this year, as I was, and I hope this information has been helpful to you. Thanks for listening.